Across two projects targets mainstreaming health in the non-health sectors to address priority communicable and non-communicable diseases within the urban areas in Nigeria. So when we talk about communicable diseases, we're talking about diseases such as diarrhea, upper respiratory tract infection, malaria, HIV/AIDS. We talk about non-communicable diseases such as hypertension, diabetes, and then certain cancer such as prostate and breast cancer.
Historically, we have found in the past, generated evidence from previous work, a wide array of ongoing multisectoral activities, especially at the community level. However, the challenge we found was that these activities were not backed up by formal policies from these non-health sectors.
So we were able to conduct a political economy analysis on these sectors, which helped us understand what is on ground and then what needs to be put in place for mainstreaming health within these sectors.
For us too is now looking mainly at the policy level, how health can be mainstreamed into these non-health sectors.
Every sector feels they should only face the mandate of that sector. Education sector feels their mandate is education, schools. Agriculture feels their mandate has to do with maybe livestock, plants, just farms. Environment feels okay, maybe pollution. Nobody actually thinks that they can include health into everyday workings of their sectors. We also have the issue of budgetary allocation. Each ministry, so to say, has their mandate. So the education ministry mandate is to cater for schools, cater for anything education related. So since that is their mandate, they can't include like health related activities per se.
Basically, the gaps that have been identified so far are the sort of trying to sustain the cohesion and the collaboration between these sectors. If non-communicable diseases are reframed in such a way that it is seen as a problem beyond the health sector and not just a health sector issue, once that reframing is achieved and the non-health sectors understand, accept, and buy into it, it becomes very easy or a lot easier to mainstream NCDs, at least non-health sectors. For the communicable diseases, these activities ongoing, thanks for the sanitation, the health education in the education sector, provision of clean water, these are all activities that address communicable diseases. And we hope that through innovative strategies, public-private partnership and others, that this will also be sustained.
We already have some sectors that have been able to mainstream health within them, such as the education sector, where you have school health programs, which they do in collaboration with the Ministry of Health. And there are also like immunization day activities where the education and the health sectors collaborate.
So far, what we have found from the qualitative work, interviews conducted with key stakeholders, shows that there are, especially in Enugu State, the current governor is approaching these sectors multi-sectorally. So where you would have, for example, the education sector, where he's setting up what is called a smart school, it's also been made policy that each of these smart schools would have a clinic which is staffed by medically qualified people.
So political will, political buy-in, are very important factors that determine mainstreaming of health.